New York State Broadcasters Association Award for Best Public Affairs Program. Each week, Dr. Sara and her guests discuss children, parenting, family relationships, and the resources you need for a productive and healthy lifestyle. And now, Dr. Sara Little.
Good morning and welcome to your Weekend Healthy Chat. As always, I'm your host, Dr. Sara, and today we have another great show lined up for you. Please join me in welcoming back Harriet Jacobster, who is an audiologist from Lyric Audiology. Good morning and welcome.
Good morning, Dr. Sara, and once again, thank you for having me.
Well, we're very excited to have you back on the show, and I heard we're going to talk about a whole bunch of different topics, mainly tinnitus, if I'm saying that correctly. But to start off, for those unfortunate listeners who might not have heard your first show, tell me a little bit about yourself and how you came into this field.
Well, I am, as you said, I am an audiologist, and I just started a private practice in Monroe about 4 years ago. I came into the field itself as a segue into my music career, that I love to study how we perceive sounds and the effect of sounds on our system.
Great.
Tinnitus itself became a specialty of mine when I worked for the VA, and that's actually where I was trained.
Oh, very nice. So now to start it off, how is it pronounced exactly? I hear it pronounced tinnitus. What is the actual pronunciation?
It can be either way, or either way, actually.
Very true.
Both tinnitus and tinnitus are acceptable. I prefer the tinnitus, and the word itself comes from the Latin, from tinere, meaning to ring or tinkle like a bell. So either way is correct.
Perfect. Now, exactly what is tinnitus?
Well, tinnitus is the term we use for the perception of a sound in the ear or the head, or in both ears, when there is no external sound present. Okay,
so hearing something that you shouldn't.
Exactly. Okay. Usually people describe it as a ringing in the ears, but some people can hear hissing, roaring.
I've heard vibrating. Patients have told me.
The ocean sound. You get people say, "Oh, I hear the ocean," or crickets. Crickets is a very popular.
That would be very annoying hearing crickets. I would much rather hear the ocean if that was the case.
Well, we'll give you the ocean. How's that?
Now, how prevalent is it?
Approximately 50 million people actually have some form of tinnitus, whether it be constant or intermittent. Of those, 16 million people actually suffer enough to seek medical help, and of those...
That's less than half.
Yeah, well, because you know why? They don't know what it is. And, you know, they say, you're right, I do have this ringing in my ears, but I thought it was normal or I wasn't. Now, there is approximately 2 million people who suffer so badly from tinnitus that they actually cannot function on a day-to-day basis.
Wow.
It is that bad for them, yes.
And what's the typical age range you see with tinnitus?
You mostly see people in the 40 to 70 range beginning to have tinnitus, but it's more prevalent as we get a little bit older.
Now, why do you think that is?
Well, one of the main causes of tinnitus is hearing loss.
Nice segue.
It is hearing loss. So as we get older and our hearing diminishes, we become more aware of tinnitus.
Now, what effect does tinnitus have on someone's lifestyle? How does it affect them the day-to-day?
Well, it can range. Okay, some people it's very mild where they say, oh, it doesn't even bother me. It's somewhere in the background. A lot of people are so bothered by it that they become depressed. They may even become, unfortunately, suicidal.
Oh, geez.
Yeah. On the average, though, most people find it, like you said, annoying to have the sound in your ears almost constantly. It can interfere with sleep. It can interfere with concentration, especially when it's quiet. Or it can just be in the background saying, I can't sleep, it's there, it's annoying. So basically it's annoying.
And is that when you usually see people who seek medical treatment for it or to seek help for it, is when it starts to really affect their lifestyle?
Yeah, unfortunately, they do wait that long.
Right.
You know, maybe if they started earlier, it's easy to help. But yes, when it starts to say, I can't move, I can't get up in the morning, I can't fall asleep, they realize something's going on.
Right. Now, I know you brought up depression. Now, what role does depression play in tinnitus?
Well, depression is the catch-22 of tinnitus, okay?
And what do you mean by that?
Well, depression does not per se cause tinnitus. But tinnitus, because it's annoying and it's constant and it can make your depression worse. All right. So as your depression gets worse, everything gets worse. Every little ache and pain is exaggerated. So with the depression, the tinnitus, the person's reaction to the tinnitus becomes exaggerated, and then
more extreme.
And then that makes the depression work. So it's a vicious cycle that feeds into each other.
So do you suggest to patients who are suffering from tinnitus that may have a depression component, do you start with the depression first?
Actually, and this goes into the treatment of tinnitus, it's a group approach. We take care of everything. We take care of the tinnitus and we take care of the depression.
Now, are there different types of tinnitus?
Yes. There are basically two types of tinnitus. The first type is subjective tinnitus, and that's the tinnitus that the person alone can hear. All right? Then there is also something called objective tinnitus, which actually other people can hear. They can put a stethoscope up to the patient's ears and they can actually hear it. Subjective tinnitus is usually that one that's described as the hissing, the chirping, something like that. The objective tinnitus, on the other hand, is usually pulsatile or like a heartbeat. And that really needs medical attention because that could be the sign of either a circulatory disorder or maybe even a little growth in the ear.
Right. Now, is objective tinnitus more likely associated with hearing loss?
No, it's actually the other way around.
And what's the reasoning for that?
Well, objective tinnitus is usually caused by a actual medical problem. Like I said,
like some underlying condition.
Yes, exactly. Pulsatile, it can be caused by TMJ. The subjective tinnitus is more likely to be caused by a disorder in the auditory system, hearing loss, certain medications, stress even, and depression can make it worse.
Right, yes. Absolutely. What are some of the medications that can cause tinnitus?
Well, there are a group of medications called ototoxic medications. Ototoxic meaning they're actually poison to the ear. And the most common ones are, like, for instance, aspirin, painkillers. Aspirin is notorious for causing tinnitus.
Now, is this something you have to take long-term in order for you to see the effects, or is each person affected differently?
You're right. Each person can be affected differently. It can depend on whether or not you're taking other medications. It can depend on how long. It can be dose-dependent. It can be time-dependent. The important thing, though, is if you suspect the medication is never, ever stop or reduce a dose until you speak to your doctor.
Absolutely.
That is absolutely...
We cannot stress that enough.
Exactly.
And on that note, we're going to be right back after this. Who's an audiologist from Lyric Audiology. We're talking a little bit about tinnitus, and we left off talking about what are some of the more common and maybe not so common causes of tinnitus.
Well, as I already stated, the most common cause is some type of damage to the auditory system or hearing loss. Okay, this damage can actually be something as simple as wax, a middle ear problem, some kind of growth, or it can be something a little more serious like drugs or a tumor, and of course noise. Other causes can be system-wide, such as high blood pressure, high cholesterol, viral, bacteria diseases, Lyme, thyroid, sinus, even fibromyalgia. Okay, and even sometimes a body movement, such as turning your head or bending down, can cause tinnitus. So there are hundreds and hundreds of causes.
That's quite the amount there. Now, if someone thinks they have it, what should they do?
Well, the first thing they really should do is go and mention it to their doctor, to their physician. It should not be ignored because tinnitus in itself is not a disease. It is a symptom. It is a symptom that something is wrong. So we always have to rule out a medically treatable cause. Unfortunately, most doctors don't know that much, and they'll just say, it's nothing, just learn to live with it.
Oh. I could not learn to live with chirping in my ear. There's no way.
And then they really should follow up or go next to an audiologist who knows something about tinnitus to get a full evaluation.
Now, what is a tinnitus evaluation?
Okay, tinnitus evaluation is several steps. The first one is, of course, a complete hearing evaluation to see if there is any damage to the auditory system. Mm-hmm. Okay. Then there is the actual tinnitus itself that we evaluate as far as the pitch of it, how high, low, is it loud, is it soft, is it intermittent, can we mask it out, can any other sounds cause it to go away? And that's known as residual inhibition. We also involve a team in the evaluation as well as the treatment, and that would be an ear, nose, and throat specialist, as well as a neurologist, and sometimes even a psychologist or psychiatrist.
Right, especially with the depression component. Absolutely.
Exactly, and yes.
Now, are there any other hearing problems that accompany tinnitus?
There are two other problems. Some people with tinnitus claim to be sensitive to certain sounds that actually hurt their ears or that normal sounds are unbearably loud. This is known as hyperacusis. Just everyday environmental sounds are too loud. The other thing that goes along with tinnitus is an actual fear of certain sounds known as misophonia. Where certain sounds like fingernails on a chalkboard or someone chewing actually makes them scared and nervous, and they avoid these sounds.
Right.
Yeah, both of these conditions are treated along with the tinnitus.
Now, what are the treatment options available for tinnitus?
Well, if there is no medical treatment like removal of wax or, adding a vitamin, there are several options. The most successful ones include some kind of sound therapy where we don't mask the sound, but we add sound so that you're not as aware of the tinnitus.
Right.
This enables us to habituate or get used to the sound, just like you would be used to your air conditioning motor or
that white noise in the background.
Exactly, something. The other half of that is some kind of counseling or cognitive behavioral therapy that trains you to not to have such negative thoughts, but to change negative thoughts into more positive thoughts.
Right.
Okay. Currently, I just read, actually, that there is now a pill that they're trying to devise over in the United Kingdom that might take away some of the effect. But as of now, there is no miracle pill. There is no miracle cure. We treat the tinnitus.
Absolutely. Now, is there any way to prevent it?
Yes, basically, since the leading cause is hearing loss, watch your hearing. Avoid noise. Get regular checkups. At 40 years old, you should get a baseline. Okay?
And this is a baseline hearing evaluation?
A baseline hearing evaluation, yes. And keep your body healthy. Avoid stress. Try to cut down smoking. Try to avoid or limit certain medications on the advice of your physician. So just keep yourself healthy, protect your hearing, and you might prevent it or you might slow down getting tinnitus.
Now, I know we wanted to talk about it, especially because it's been in the news recently. Tell me a little bit about Harper Lee and what's going on with her.
Well, Miss Lee is, as it was cited in the AP article, hard of hearing, okay? And some people even think she may be demented. Well, I want to relay a quick story to you. That when I was a beginning audiologist, I worked in a nursing home. And I approached the patient, and everyone said, don't bother talking to her. She's demented. She'll never answer you. So my wheels were turning, and I took the stethoscope from the nurse. I said, do you mind? And I put them into the patient's ears, and I talked into it. Her eyes lit up, and she had a conversation with me.
Wow.
The gist of this is people sometimes confuse hard of hearing with dementia. However, there is a study from Johns Hopkins that shows that hearing loss can add to cognitive decline. Of course, if you can't...
The same way it adds to depression.
Exactly. If you can't hear, you can't process, and you're isolated.
Absolutely.
Yes. So, yeah, Go ahead.
Now, are there any resources for the public to learn more about tinnitus?
Yes, there is. The biggest one is the American Tinnitus Association, ATA.org. It is a wealth of information. They lead research in tinnitus, and they have a list of professionals in your area, I'm one of them, who can help you with your tinnitus.
Well, that's great. And anything you wanted to leave our listeners with before we wrap up our segment?
Just basically don't ignore it. If it's there, take care of it. It
Seek
can
medical
be.
advice.
And yes,
Absolutely.
you can be helped. There is help out there.
Well, Harriet, I just want to say thank you so much. As always, it was a pleasure having you on the show.
Thank you again, Dr. Sara. It's been wonderful.
Great. And we'll be right back after this.